Okay, happy Friday, Maternity Massage Collective friends. And today it's just going to be me, although I do have a few little notes that Pamela left me to kind of weave into today's discussion topic. And if you have any questions as I go along, like feel free to drop them in the chat. But today we're going to be talking about anxious clients and how that can show up in pregnancy, how that can show up in postpartum, and the unique ways that we can hold space for them as massage therapists. So first thing that I want to say is that, anxiety can be, totally normal and totally welcome. I think that generally speaking, there is a sense from anxious clients, and I feel like I've worked with a lot of them. And I think part of why I have worked with quite a few and maybe have been a good fit for a lot of anxious clients is because I really love people who want to participate in their care or who have questions about things. And some of the feedback that I have gotten from past quote unquote anxious clients was that like, oh, you don't seem annoyed with me. Because I think sometimes their questions and the amount of reassurance that some of them might need adds a certain level of pressure onto themselves of, not only do they need that reassurance for their own nervous system, but then they also feel like they're burdening or bothering or irritating somebody else. And that just, it's never been something that has irritated me as a therapist. I always love people who are curious, who are engaged, and I welcome a lot of questions, and I welcome a lot of curiosity. And I think that a lot of that comes from never putting that pressure on myself to feel like I have to know everything. It's like, sure, I know a lot, but I don't feel like I have the pressure to be an expert on this person. And I think that relieves a lot of the pressure sometimes to just discover together what can work for this particular person. And I think when you approach sessions in that way, for someone who might have had other experiences with other care providers where they felt either the person didn't have the time or the interest to really hear what they were saying, even just having a little bit of space, a little bit of curiosity, welcoming their questions can be huge. So that's just like a little intro here. There's a lot that we can go into. The other thing that I wanted to say about this is that if someone has anxiety, non-pregnant or non-postpartum, this is certainly a time where it can flare up even more. And there are potentially people who might not have thought of themselves as anxious. And then when you step into this huge threshold of motherhood, it can really come up. And one of the quotes that Pamela sent me, where is it? It's from Bodywork for the Childbearing Year, is that the work of pregnancy is to worry. And part of that is because you're sitting in such a huge unknown. And I think each pregnancy you're asked to sit, within a huge unknown. But I think specifically the first time moms, it's an even greater unknown of what will this be like. There's many, many things that cannot be reassured, even with all of the best testing, things are sometimes wrong, things are sometimes missed, sometimes things are misdiagnosed and everything's fine. There's, a huge gamut of what can, come across your plate. But the truth is that you cannot completely be reassured and have all of your worries taken away. So I think that normalizing that to a certain degree, not making your clients feel wrong for having these feelings, right? It's a huge threshold that they're standing upon if they're pregnant or if they're early postpartum. There's so many things to worry about, and, feeling like it's going to be harder now to protect your baby because your two bodies are now separate. There's, so many things that come into play, and there's nothing usually more precious than your baby, your children. And so that level of anxiety can be very understandable. I also wanted to mention too that, especially in postpartum, anxiety can come into play, even if it didn't necessarily exist during pregnancy, depending on how the birth unfolded. So if someone has had a traumatic birth, they might be dealing with postpartum anxiety in the aftermath of their birth and trying to navigate that. I can just share personally that I experienced postpartum anxiety in my first birth, which was quite traumatic, for about 8 months postpartum. And how it showed up for me was that no matter how brutally exhausted and tired I was, I could not close my eyes and go to sleep when the baby was asleep. I could be just totally exhausted and the baby's sleeping, and I would be afraid to close my eyes and take my eyes off of him. And that, I think, was very much, a response to quite a traumatic experience that I went through. And you might have clients who are also dealing with that. And it got subsequently better, and it did eventually disappear. But I think that the little bit of touch that I got in postpartum, which I can say, my first son was born right after COVID happened. And so even, in the career that I have, the team that I had, it was even difficult for me to get the level of care that I would definitely recommend for any new mother. The little bit of care that I was able to get was very, very helpful. And I honestly do feel that if I had had access to more care at that time, it would have been tremendously helpful, especially if I could have counted on it on a regular basis. So, again, this is all just to say, don't underestimate the value of your presence and of your touch, and knowing that we can really make a difference in these pivotal times in life. Women remember how they were spoken to, how they were treated, how they were touched during pregnancy, and same for postpartum. And we can make a really big difference. So those are a couple things to keep in mind. There are always going to be thresholds, right, of what is normal, even high-end anxiety, and what might be bordering on paranoia or something, more severe going on. And so being able to have trusted perinatal health professionals that you can refer to when needed, when something is outside of your scope, is going to be really helpful. I have had a couple of clients who dealt with postpartum psychosis, and in both cases it was induced by lack of sleep, of being awake for about 3 days straight and then really being disoriented to the point of potentially being a danger to themselves or to their babies. And so these things are real, and these are things that might come across your plate as a massage therapist. And so making sure that you can kind of assess, is this anxiety, or is this person actually losing a little bit of grip on reality? Are their partners or family worried about them? Do they pose any kind of threat to themselves? And if you're not sure, again, if you have these referrals, you can reach out and maybe, you don't have to give any identifying details clearly, but if they think that this is something that maybe should be referred out or taken more seriously, those are things to be watchful of when we're dealing with our anxious clients. But most of the time, the vast majority of the time, that's not what we're going to be dealing with. We're just going to be dealing with people who have higher needs, a more difficult time relaxing, who are needing to be understood and seen in a way that might be more detailed or more in depth than other clients. And so I don't see those as a problem or as an issue at all. If you have the time and the bandwidth, sometimes if it's your first time working with a client who is self-identifying as anxious, if you can have them maybe pop into your office and meet you or see your treatment space ahead of time, that can instantly reduce their anxiety. Letting them know, or even if you're just texting with them, sending them photos of where they will be, describing what the process is like, even like some things about like where to park and what you'll see when you come in, and you know, who do you talk to right away. Those are things that seem very small and very basic, but are things that can immediately start to lower someone's anxiety before they walk into your treatment room. Because no matter how much someone might need our touch and our care, it does take a certain level of bravery and requires a certain level of vulnerability, that sometimes a little bit of our foresight and just a little bit of extra support can go a long way to helping someone who just needs a little bit more hand-holding. There's nothing wrong with that, especially in a time in life where you're just naturally more vulnerable. So, you know, and then in terms of positioning, sidelying, which of course is my preferred position for prenatal massage, it's going to put that person into a fetal position, which is going to naturally feel really soothing to their nervous system. And you can even tell them that. And I think even before they get on the table, you know, giving them some ground rules about, you know, this is their session, right? And so, you know, saying things like, if you need anything different at any point, I am here to tailor this session for you. So if something is distracting, if the room is too cold, if you hate the song or the birds in the background of a song, this has really happened to me before, just feel free to let me know. You don't have to suffer through anything. Yeah, if you need a different level of pressure, let me know. If you are feeling like my pacing is moving too fast or too slow, I can change that. If you need to pause or to stop at any point in the session, you know, I've had a couple of anxious clients who just needed to stop and sit up and have a little sip of water and orient a little bit to the space, and to know that my reaction was totally fine with whatever they needed. And then we could continue the massage. So I think even just laying a little bit of those ground rules, that there's spaciousness, you know, that they don't have to, for lack of a better word, like be a performative client, you know, and pretend like they're enjoying every second of it, but to genuinely co-create something with you, and to know that whatever it looks like is totally okay, including and up to like stopping the whole session if it doesn't feel good. Or even if it feels good, but they internally are stuck in some emotional place and they need to stop, allowing that to be okay. And sometimes just saying that right up front allows people to not feel trapped, so that they know that they have an out, you know, and that you're not going to take it personally, and that, you know, their comfort and their care is your number one priority. So I think kind of laying those ground rules at the beginning of the session can go a long way. So, and then, yeah, positioning can be great. Checking in can be great throughout the session. And sorry, going back to positioning, fetal positioning is going to be ideal for pregnancy for sure. Semi-reclining could also be appropriate sometimes for anxious clients, because there's not going to be as much of that, like your body over their body, which can feel like there's a little bit of a power dynamic there. So that's something to consider if somebody prefers being in a semi-reclining position. You know, they're up and they kind of orient to the room if needed. You know, and ideally it's like we want them to turn off that vigilant part of their mind, but that might take a little bit, and that might not happen in the first session. And so just knowing that it's okay if it looks a little different, or it's, you know, less than ideal, that you're still building trust. That's the most important thing. You're building trust, you're building rapport, you're helping them feel safe. That's the most important thing. And that the other stuff can come as a result of that in the future if you can do this moment with them really well. So those are a couple of thoughts. Also for postpartum, if you're doing any supine work, if you include abdominal work, if you're doing neck work, if you do any lactation work, anything like that, if I have clients who are anxious, I will often just put a small pillow behind their head so they're not laying completely flat. And just that little tiny bit of incline can often help them feel less vulnerable. It's a little bit less of that feeling that somebody is standing over you, and a little bit more of a sensation that, I don't know, it's very subtle, but that you have a little bit more autonomy in your body. So that's something to consider as well with positioning. In terms of the quality of your touch, you know, inviting touch, I think that goes without saying with anyone, but particularly so with somebody with anxiety. May I touch you here? You know, asking ahead of time, are there any areas that you don't want touched at all? Those can be very thoughtful questions for someone with anxiety. And, you know, working with the breath, right? Because you might need to have to train them a little bit to what relaxation even feels like, because it might be something that can be a little bit hard for them to even access on their own. So, you know, doing breath work, doing guided breath work, checking in with them, slow, deep work, I think tends to work better for anxious clients. And yeah, I think the breath is going to be a huge component of that as well, like whole body breathing, seeing if they can expand their rib cage side to side to get that lateral breath, seeing if they can breathe into their back body, and you can place a hand on their back, seeing if they can move your hand with their breath so that they're really using up their full lung capacity, can be great. You can also help them like just kind of orient to the room, maybe helping them as they're breathing. Like, I'm particularly thinking of people who don't want to close their eyes or don't feel safe to close their eyes, you know, and you've probably had those clients where it's like you're looking at them and they're just like wide-eyed, and you're like, is this person going to relax? Sometimes they just can't quite get there, and so sometimes helping them come into the moment by sticking with their breath, not telling them to close their eyes if that doesn't feel authentic to them, but maybe helping them orient to the space, maybe asking them to notice 3 calming elements in the room, you know, and then they can kind of look around, and they're getting their nervous system to track what they're seeing. Okay, I'm seeing 3 calming elements in the room. They can name them if that feels good to them. They can also think about anything that smells good, or and you know, and then of course you want to tune into what are you actually feeling in your body. You know, is there anything that's pulling your attention? Is there anything that's feeling really good? Can we stay present with what's feeling really good? And I think eventually, as you kind of make their world smaller, right? Just by noticing, just by bringing it to this present moment and the breath and what's around them, maybe reminding them of your intention to, you know, create a safe and comforting space for them, that's where their nervous system is going to maybe be able to start to take a turn towards relaxation, and allowing their eyes to close, allowing their breathing to regulate a little bit, allowing the tissue to really receive the touch that you want to give them. And so that can take a little bit of work, and a little bit of patience, you know. And so again, I think that as massage therapists, potentially anyways, like you have to sometimes set aside a little bit of your ego, right? And being able to really meet someone where they're at, and not take anything personally, and just show up to the best of your ability in service to this person and to their healing. So yeah, in terms of you know, besides breath work, there's a lot of sedation techniques that are in this textbook, or if you've been in a class with any of us that we go through, and those could be really wonderful for anyone with anxiety. I also tend to do a lot of, if they're open to it, pectoral girdle deep tissue sculpting, so that there actually is a bigger capacity to take deeper breaths. So like I'll do deep tissue sculpting in the scalenes. I'll do deep tissue sculpting across pec major. I will get into pec minor. I will do ribcage deep tissue sculpting. I will do trigger point work in their intercostals. All of these things are going to translate into freedom in the pectoral girdle and the ability to take a deeper breath. And so sometimes that physical freedom of being able to breathe can give you the mental freedom, right? And then the ability to kind of circle back and take deep breaths again. So those are some like mechanical things to keep in mind. And again, like always asking permission, always inviting feedback. But a lot of the deep tissue sculpting work can be very, very relieving. Like I've had clients describe it as literally like weight feeling like it's coming up off of their shoulders, things that they've been carrying around for very long periods of time. So yeah, all of that can be really, really helpful. I'm trying to see here if, Margaret, I can see that you're on too, but sometimes I cannot see questions. So I was gonna see if I could like view this on my computer as well and see if there's any questions that I have missed. Okay, so right now I don't see any, but if you come up with any, just let me know. And I'm trying to think if there's any other stories that I want to tell you. I think that what I started off with saying has just been true for so many of my clients, that I have been told many times that I have been one of the only care providers that didn't kind of shame people for having anxiety, which is always shocking to me, or that I genuinely didn't seem annoyed. Yeah, I just feel like it's a privilege, you know, to work with with women and families during this time in pregnancy and postpartum, and the anxiety is so deeply understandable to me. And again, I guess because I don't consider myself like a healer, I've always kind of shied away from that term, because to me it feels like it feels very weighty. It feels like I have to be doing something and achieve a certain result, rather than what I consider myself is to be more of a facilitator, helping you feel safe so that your body can do what it's already primed to do, what it's already intelligent enough to do. And so the achievements that we make, it's you who's doing the healing, but maybe I'm helping to create the environment and maybe the stimulus and a little bit of guidance to help that happen. And I think people really can feel the difference when you approach it that way. And I sometimes wonder, you know, especially with doctors, they don't have that. They don't have that flexibility. They have to almost be godlike almost in their ability to never be wrong. And therefore, you know, somebody who has a lot of questions can almost feel threatening under those circumstances, because they have to be right and they have to have the answers. And I feel like as massage therapists, we don't necessarily have to have the answers. We just have to be transparent and kind and reassuring, in the sense that, you know, you let someone know that this is what I can offer. I might not be sure about X, Y, and Z, but I think that we can figure this out together, you know? And again, thinking about setting those boundaries for safety before someone even gets on your table, so that they know that they can use their voice, that your intention is to serve them, that they can ask for anything different, whether it's another blanket, or whether it's more time in this certain area, or whether it's to slow down, or whether it's to pause. All of these things just really go hand in hand, I think, with respecting anxiety, giving people pathways to navigate through it, and to, yeah, just really being, you know, a dynamic therapist that can handle, you know, whatever comes across your plate. So I hope that this is helpful. Oh, let's see. Sorry, I saw your message. Margaret, okay, but it was your cat. Okay, good. If you have any other questions, just let me know. But I think that is about all I have to say for today on anxiety. You know, it's still going to be a huge topic, but again, I think that so much of what we can offer as massage therapists can really beautifully shape someone's journey. I feel like we can play a significant role in someone's journey. And yeah, I just invite you to embrace your anxious clients. I have personally had many of them and have gotten so much satisfaction out of working with them. And yeah, I feel like it's a beautiful way to show up for someone who might not have that level of care or thoughtfulness in sort of like in their mainstream like medical journey. So I hope that's helpful. Thank you all for being here. And then Pamela and I will be back next week. So enjoy your weekend. Take good care. We'll see you next time.